Hello and welcome to the Pisgah Health Today. My name is Angela Owen and it is my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Lee Angel, who serves as the Dean of Health Sciences at Blue Ridge Community College. Welcome to our program today, Lee.
Thank you very much.
Prior to serving as the dean there at Blue Ridge Community College, she was the director of the Ribbon Program at Western Carolina University. She has been the Accreditation Readiness Specialist for Mission Health Systems, the Medical Surgical Telemetry Nursing Unit Director at Park Ridge Health, and she is in her final year of achieving that PhD in nursing from the University of North Carolina, Greensboro. What an incredible accomplishment that will soon be. She has a master's in science in nursing administration from Western Carolina University, as well as her bachelor's in nursing also from Western Carolina University. Again, welcome to our program today, Lee. We are super excited to have you and excited to learn more about the health sciences at Blue Ridge Community College. Why don't you tell us about that?
So the Health Sciences program at Blue Ridge Community College houses nursing, the associate's degree nursing program, and we also have surgical technology and allied health. And within allied health, there's a lot of different opportunities, such as nurse aid programs, medication aid. We also have phlebotomy, EKG, medical assistant, all those different kinds of careers that are very valuable to our healthcare system.
Most people don't know all the things that happen right there at Blue Ridge Community College and that health sciences. What about the grant that you recently received from Pisgah Health Foundation? How is that going to help you serve the residents of Western North Carolina in that particular department there, the health sciences area?
I think when we looked at what our community needs are, when the Pisgah Health Foundation released its call for grant proposals, and their goal and mission was really to address social determinants of health within Western North Carolina, which are things like mental health, housing, all kinds of food insecurity, different things like that that affect people in such a really intimate way. And in our health sciences program, we recognize that Blue Ridge Community College needed to come to the table as an education partner in addressing those needs within our community. We've done a great job for a long time of educating people to achieve career goals, but we really hadn't done a whole lot to address mental health care needs in our community, and we recognize that as a significant need. It's on our top priority list for our community health assessments every year. So we were really thinking about how can we come to the table and use our strengths as an education partner to elevate education within our community, not only for workers in our community, people who need to work in the healthcare field, but also to elevate education of our community about mental health. What struggles do people face with mental health, and how can those be addressed, and what resources are available? So within our allied health programs, we recognized that we could develop some continuing education programs. And so we did develop 2. One is substance abuse education, and that is open to anybody in the community that might have a loved one that is struggling with mental health. Maybe they are in the active phase of recovery from addiction, or just a variety of different levels within mental health. And that is really designed, it doesn't end up in a credential, but it's good information for anyone who loves someone with mental health. And on a personal note, my family, I have a brother who passed away at the age of 42 from alcoholism, and it was just a real personal thing for my family of how do we love him through this phase, and how do we walk with him through, and we just didn't know. So this course really provides information to family members, to community members, of how to love someone who has mental health illness and walk with them through those phases. The second program we developed was psychiatric technician, and that's developing our workforce of someone who can provide high quality care in a mental health care setting. So that was important for us. And the third goal of our grant was really to convene the community together, to bring together all the resources that we have in Western North Carolina and Henderson County and Transylvania County, to say, here's what's available to you. Here's what you might need. Maybe you didn't know about this service. Maybe you didn't know about this agency that provides this service. And that is a way for us to educate the community on what's available to them. How do normal people deal with mental health, and how do we access the resources within our system? So that's how the grant came to be. And those are the three goals of our grant, is really to educate our community, educate people within our workforce, and educate our community about what resources are available to them.
Lee, I love that I'm hearing you speak about very practical, all the way from that family phase, all the way into that professional phase, and breaking down the stigma of talking about and having that safe space to learn about. And as you said, to walk with that family member and love them well through what is really challenging and hard. And in this year of 2020, when COVID-19 has brought so many more changes, I can only imagine that you've seen perhaps an increase in the need for that program. Have you seen any direct impacts from this year, or just people willing to kind of step in and say, hey, this is a program that we really can leverage along the way?
Absolutely. I think, not only within our own community at the college here, we've seen, we've done surveys of our faculty and staff, and folks are feeling that stress of the isolation and not being able to connect with others in a normal, meaningful way. So we've worked to address some of those mental health issues of anxiety, depression, things like that within our own faculty and staff. But we're also seeing that in our community. I think there's a 30% increase in substance abuse that we're seeing in our communities nationwide. I mean, not just isolated here in Western North Carolina, but we are seeing that uptick of substance abuse that's happening. That really, one of the main things in substance use and addiction is when we can connect people together and have them out of that isolation, that's when we can help walk them through addiction and into recovery, is when we connect them with other people and connect them with resources. But in this day of COVID-19, we've got so much isolation happening where people are not able to connect. And so that we are seeing that uptick in mental health needs.
Well, and creating those educational programs, the opportunities to connect, as you so have well said here along the way. Lee, what else would you like, before we wrap this interview up today, what else would you like for our viewers to know and understand about what you do there through the health sciences at Blue Ridge Community College? How can we come alongside you, get involved, and support?
Absolutely. I think it's important for our community to know that we are here. We are here as an education partner. We want to care for our community. And I think that's a beautiful thing about an education setting in a community, such the community college is here as part of someone's educational journey. So we don't want to be overlooked, for folks that are wanting to go to a higher ed institution. We want to be part of that journey with them, so we can get folks started on an education journey and help them transfer into a higher institution. But in the terms of health sciences, we're here to care for our community. We are producing nurses, nurse aides, medical assistants. We also have emergency management services here, so paramedics as well. But these are folks who live in our community, and we serve our community. And so we want to be seen as that community partner on all levels, whether it's providing education for others, or it's actually training and educating and training our healthcare heroes. It's really important that our community knows that we are here as a vested partner. We're here for you because we're here with you.
So many great resources right here in our own area through Blue Ridge Community College. Thank you so much, Lee, for being here today. And on behalf of the Board of Directors at Pisgah Health Foundation, we want to say thank you to you and the rest of the department around you that is doing so many things to help meet the needs and improve those social determinants of health along the way. Thank you again for being with us today, Lee. It's been a pleasure talking with you, getting to know a little bit about the programs.
Absolutely.
There. We also want to thank Wildflower Media for their creative and technical support in bringing Pisgah Health Today to you, our viewers, as well as the Board of Directors, the staff, and the Physicians Roundtable of the Pisgah Health Foundation, all who do so many things to help improve the health and wellness and lives of Western North Carolina residents. Until we see you again on the next Pisgah Health Today, stay well, be well.